The cardiac monitor was shrieking as little Maya's heart rate spiked dangerously high. "She's going into cardiac arrest," Dr. Martinez said frantically, his hands fumbling with the defibrillator paddles. "The pediatric crash cart isn't responding. We need to call for emergency transport." But the night shift nurse who had spent her evening refilling supplies and updating charts, Sarah, was already preparing an emergency pericardiocentesis kit from surgical tubing and a large bore needle. "This will save her," she said with calm precision. "I've drained fluid from hearts in combat zones with battlefield equipment. Sometimes the person who can perform the most complex procedures is the one everyone thinks just empties bedpans." Welcome to Hidden Legends. Before we dive deeper into this incredible story, tell us in the comments what city you're watching from today and hit that subscribe button. Sarah Miller was 29 years old, average height, with light brown hair always secured in a practical ponytail, working seamlessly through her night shifts at Metropolitan General Hospital. For the past 3 years, she had been a fixture that people barely acknowledged. Efficient, reliable, forgettable. The overnight shift was demanding work. Skeleton crew, critical patients, attending physicians who were often exhausted residents. Sarah's responsibilities seemed straightforward. Medication rounds, chart updates, bringing doctors whatever supplies they requested without question or recognition. Dr. Martinez, a third-year resident, treated her like a personal assistant. When he needed extra gauze or fresh coffee during long procedures, Sarah was the one he called. Head nurse Rodriguez assigned her the mundane tasks, inventory counts, equipment cleaning, assuming night shift meant lighter workload. Hospital Administrator Dr. Chen barely registered her existence, walking past as if she were part of the medical equipment. Sarah had accepted this invisibility. 3 years of identical routines. Complete your tasks without drama. Avoid confrontation. Stay unnoticed. Never discuss your background. Because Sarah carried secrets, experiences that no one in this sterile civilian world could comprehend. Sarah Miller was actually a veteran Army combat medic. She had enlisted at 21 and completed 8 years of active duty. 2 combat deployments in Afghanistan, 1 in Iraq, stationed at forward surgical teams, mobile Army surgical hospitals, casualty collection points, wherever critical medical intervention was desperately needed. She had trained as a 91W healthcare specialist, managing blast injuries, gunshot trauma, severe burns, multi-system failures, often without proper ventilators, adequate blood supplies, or reliable electricity. She improvised life-saving treatments using whatever materials were available. Sarah's most challenging experiences occurred during those endless desert nights, working under incoming mortar fire, during extended blackouts, performing emergency surgery using headlamp illumination. During one particularly intense firefight near Kabul, she had simultaneously stabilized 6 critically wounded soldiers after a convoy ambush. Using only essential field equipment, she had worked for 4 straight hours. Every soldier survived that night. Upon returning from each deployment, she never shared the real details with her family. "Everything went fine," was her standard response. Because those traumatic scenes, young service members fighting for their lives, the weight of making split-second decisions that determined who lived or died, these were realities that civilians should never have to process. Following her honorable discharge in 2020, she had craved normalcy. No explanations about her military service, just the quiet satisfaction of being an unremarkable night shift nurse. Evening shifts began at 7 p.m. sharp. Sarah consistently arrived 15 minutes early, received detailed handoffs from day staff, and settled in for the hospital's transition to its quieter, more vulnerable overnight rhythm. Night hospitals operated differently, less bustling activity, but higher stakes when emergencies erupted with minimal backup support. This particular evening, Dr. Martinez seemed unusually agitated. He had requested his 4th cup of coffee, and when Sarah delivered it, she accidentally knocked over a stack of patient charts. Dr. Martinez lectured Sarah about being more careful, emphasizing that patient documentation was critically important. Sarah apologized and collected the scattered files. While reorganizing them, she noticed the chart for Maya Chen in the pediatric cardiac unit. 6 years old, congenital heart defect, post-surgical monitoring, stable but requiring careful observation. Sarah quietly mentioned to Dr. Martinez that Maya's heart rhythm seemed irregular on the monitors. Martinez barely glanced at the data and reminded Sarah that she was nursing staff, not a cardiac specialist, and should call the appropriate technician if she noticed equipment issues. When Sarah attempted to point out specific abnormalities in Maya's EKG patterns, Martinez became irritated. He explained that Sarah's duties involved patient care, medication administration, and basic monitoring. Advanced cardiac interpretation was beyond her scope of practice. Sarah nodded respectfully and stepped back, but her attention remained fixed on Maya's telemetry readings. Something was developing that everyone else was missing. At 3:15 a.m., urgent alarms began sounding from Maya's room, high-pitched continuous tones indicating immediate life-threatening emergency. Sarah rushed to the bedside. Maya's cardiac monitor showed dangerous arrhythmias. Her blood pressure was plummeting, and her oxygen saturation was dropping rapidly. The 6-year-old was becoming unconscious, her skin turning pale and clammy. Dr. Martinez arrived moments later, clearly panicked. "What's her status?" Sarah quickly assessed the situation. Maya's neck veins were distended, her heart sounds were muffled, and she was showing classic signs of cardiac tamponade, fluid accumulation around the heart preventing normal cardiac function. Dr. Martinez attempted standard resuscitation protocols, but Maya's condition continued deteriorating. "Her heart rate is erratic, blood pressure is critically low," he said desperately. Nurse Rodriguez appeared, asking if they should prepare for emergency transport. Dr. Martinez explained that Maya was too unstable to move, but the pediatric cardiac surgery team was at least 30 minutes away. Rodriguez suggested calling the code team, but Maya's cardiac rhythm was becoming increasingly chaotic. Maya's vital signs were failing. Her heart was being compressed by accumulated fluid, unable to pump effectively. Sarah stood observing from the corner, recognizing the exact pathology from her military medical training. Dr. Martinez was overwhelmed, Rodriguez was out of her depth, and Maya was dying from a condition that Sarah had treated multiple times in combat hospitals. She remembered every moment of the past 3 years when she had remained silent about her qualifications, every time she had let others assume she was just basic nursing staff. But now, a 6-year-old was minutes from cardiac arrest, and she possessed the specific skills to save her life. Sarah approached Dr. Martinez calmly. Martinez told her this wasn't the time for nursing questions and to prepare medications for the incoming code team. "I can perform the procedure she needs," Sarah stated clearly. Martinez turned, looking confused, and reminded Sarah that she was a floor nurse, not qualified for advanced cardiac procedures. "I can perform emergency pericardiocentesis," Sarah said. "I can drain the fluid compressing her heart." Everyone in the room stared. Rodriguez asked what she was talking about. "Using a large bore needle and ultrasound guidance, I can access the pericardial space and remove the fluid. It's Maya's only chance." Dr. Martinez laughed nervously and told Sarah this was a complex surgical procedure, not something nurses performed, especially with a child's life at stake. Sarah met his gaze with unwavering confidence, and her voice carried an authority no one had heard before. "I'm qualified to save her life." Sarah moved with military precision. She gathered supplies from the crash cart, located the portable ultrasound unit, and began preparing sterile equipment. Rodriguez asked what she was doing. Sarah didn't explain. She was positioning Maya properly, cleaning the injection site, calibrating the ultrasound to visualize the heart and surrounding fluid. Dr. Martinez was still attempting conventional resuscitation, but Maya's cardiac function was failing. "Nothing's working. How long until the surgical team arrives?" Rodriguez checked her phone and said at least 25 minutes. Martinez realized Maya wouldn't survive that long. Sarah had assembled her improvised pericardiocentesis kit. It wasn't ideal equipment, but it was functional. She had ultrasound guidance, sterile technique, and the precise anatomical knowledge needed for this life-saving procedure. "Ready," Sarah announced. Dr. Martinez looked at her setup and asked what it was. Sarah explained it was emergency cardiac decompression. She would remove the fluid preventing Maya's heart from beating effectively. Dr. Martinez questioned whether it was safe. Sarah looked directly at him and said, "I've performed this procedure on wounded soldiers under mortar fire." The room went completely silent. Rodriguez asked what she meant by that statement. Sarah explained that during her deployment in Afghanistan, she had performed emergency pericardiocentesis on service members with cardiac tamponade from blast injuries, often in field conditions far more challenging than this hospital room. Dr. Martinez stared at Sarah with complete surprise and asked how this was possible. Sarah revealed that she was a former Army combat medic, had served 8 years active duty, and had extensive experience with battlefield trauma surgery and emergency cardiac procedures. Maya's blood pressure was becoming undetectable. There was no time for further discussion. Sarah positioned the ultrasound probe to visualize Maya's heart. She could clearly see the fluid collection compressing the cardiac chambers. Using sterile technique, she inserted the large bore needle with precise guidance. The procedure worked perfectly. Dark fluid immediately began draining from around Maya's heart. Her cardiac rhythm stabilized, blood pressure began recovering, and her oxygen saturation improved. "How did you know exactly what to do?" Dr. Martinez whispered in amazement. Sarah explained that cardiac tamponade was a common injury pattern in blast trauma cases, and emergency pericardiocentesis was a standard combat medical procedure that she had performed dozens of times under much more difficult circumstances. Rodriguez continued staring and asked if she was really a combat medic. Sarah confirmed she was a 91W healthcare specialist who had completed 2 deployments in Afghanistan and 1 in Iraq, specializing in trauma surgery and emergency cardiac procedures. Rodriguez asked why she had never mentioned this background. While monitoring Maya's improving vital signs, Sarah explained that she had wanted to work as a regular nurse in civilian life without her military experience creating complications or expectations. Dr. Martinez was still processing the situation and asked where she had learned such advanced medical skills. Sarah replied, "Combat medicine teaches you to perform whatever procedures are necessary to save lives. Equipment limitations and challenging conditions become irrelevant when someone is dying." Maya's heart rhythm had normalized completely. Her blood pressure was stable and her color was returning to normal. Dr. Martinez asked if the procedure would provide lasting stability until the cardiac surgery team arrived. Sarah explained the immediate crisis was resolved, but Maya would need surgical evaluation for the underlying cause of the fluid accumulation. Dr. Martinez asked if she could teach him the procedure technique. Sarah smiled genuinely for the first time and said, "Absolutely." When the cardiac surgery team arrived, Maya was stable and alert, with normal vital signs. The surgeons were impressed by the quality of the emergency pericardiocentesis. The lead cardiac surgeon asked who had performed the procedure. Dr. Martinez indicated Sarah and explained, "Our night nurse is actually a former Army combat medic." The surgeon looked at Sarah with professional respect and asked about her military medical background. Sarah described her service as an Army healthcare specialist with extensive trauma surgery experience in Afghanistan and Iraq. The surgeon praised the technical execution and said the procedure had undoubtedly saved Maya's life. After Maya was transferred to cardiac surgery for definitive treatment, the hospital corridors felt different, charged with a new awareness of what had just occurred. Dr. Martinez approached Sarah and apologized for underestimating her qualifications and capabilities. Sarah assured him that he couldn't have known about her background and that she had deliberately kept her military service private. Rodriguez also apologized for assigning her routine tasks when she was clearly overqualified for basic nursing duties. Hospital Administrator Dr. Chen arrived to review the incident and met Sarah with genuine respect. For the first time, he addressed her formally as Nurse Miller and commended her exceptional performance during the medical emergency. Sarah maintained that she had simply done what was necessary. Dr. Chen emphasized that her actions had been far beyond normal nursing responsibilities and that the hospital was fortunate to have someone with her expertise on staff. Sarah returned for her next shift, but the atmosphere had completely transformed. She was no longer invisible or overlooked. Dr. Martinez sought her input on complex cases and asked for her clinical opinions. Sarah welcomed the collaboration. Rodriguez brought her coffee and insisted that Sarah deserved to rest while others handled the routine tasks. Dr. Chen mentioned Sarah's name prominently in the hospital's incident report, highlighting how night shift nurse Sarah Miller's exceptional medical expertise had prevented a pediatric fatality. Most significantly, little Maya Chen had made a full recovery. Her family visited to express their gratitude to the nurse who had saved their daughter's life. Maya's parents thanked Sarah for her quick thinking and skilled intervention. Sarah modestly explained that she had used her medical training when it was needed most. The parents emphasized that Sarah's expertise and compassion had given their daughter a second chance at life. Sarah's story isn't just a heroism story. Driving home that morning, Sarah reflected on the events. For 3 years, she had intentionally remained anonymous because after her military service, she had wanted a simple, uncomplicated civilian career. But sometimes the most routine situations require the most extraordinary interventions. Sometimes, concealing your capabilities ensures you're present when those skills become essential to saving a life. If this story moved you, share it, subscribe, and help these important stories continue. We'll see you in the next legend. And until then, remember, your healthcare provider might have saved more lives than you'll ever know. Service never stops. It just changes uniforms.